Last year, ASCO identified 5 key areas where we should be focusing on improving care. And one of them is an emphasis on not using medications, not using chemotherapy where there's no evidence. So we did a study looking at patients in the Medicare age range, over 65, using a database called SEER Medicare. And we looked at a variety of patients diagnosed with advanced cancer over a 10-year period. We looked at patients with breast cancer, ovarian cancer, prostate cancer, pancreatic cancer, myeloma, lung, and uterine cancer. And what we were interested in was patients that received drugs for the treatment of their cancer that did not have FDA approval. So the first thing we did was we identified all the drugs that these patients had received over the course of their care. And we looked at the percentage of patients that received at some point a drug that was unapproved. And we found that about 45% of patients received a drug that was not FDA approved. Of those patients, we then took that sample and we looked at whether or not the drugs that they received were approved by a compendia. And the compendia that's most commonly used for cancer patients is NCCN. So there are a lot of drugs that have evidence, but the company has not gone and gotten FDA approval. And those drugs are called Compendia-Approved. And it's generally believed that those drugs should be paid for by insurance and Medicare. So we then looked at the number of patients that had unapproved drugs that were Compendia-approved, and a large number of them were.